Hi and welcome back to another video of Medic Notes. This video is on prosthetic joint infection. Prosthetic joint infections are serious complications of hip and knee arthroplasty, and a common cause for revision arthroplasty. Diagnosis is multifaceted and includes elevated inflammatory markers, radiographic changes around the prosthesis, and aspiration results. Treatment generally involves prolonged IV antibiotics and two-stage revision arthroplasty. There are pre- and post-operative risk factors. Pre-op risks are active infection or previous local surgery or infection. Post-op risks include immunosuppression, inflammatory arthropathy, lifestyle factors, and morbid obesity. Common organisms are bacterial, Staph aureus and epidermidis, and fungal or Candida albicans. It can be classified via time of onset. Acute onset is infection within 90 days from joint replacement, whereas chronic is more than 90 days from op. It can be classified also into source of infection, whether direct invasion or hematogenous spread. For clinical presentation, history might suggest recent or active bacteremia, multiple local surgeries, skin or epithelial tissue penetration. Symptoms are persistent pain and stiffness at site of arthroplasty. Acute onset with swelling, tenderness, and drainage. Chronic infections have pain and more subtle symptoms, like function deteriorates over time, or pain worsens over time. On inspection, look for sinus tract to the joint, warmth, redness, swelling, and fever. ROM is limited by pain and swelling. For imaging, radiograph findings include periosteal reaction, scattered patches osteolysis, generalized bone resorption without implant wear, transcortical sinus tracts, and implant loosening. Other tests include bone scan or PET scan. Lab investigations are WBC, CRP, ESR, and serum interleukin-6. Joint aspiration to check the cell count, crystal, gram stain, culture and sensitivity. And other tests like alpha-defensin immunoassay test, leukocyte esterase colorimetric strip test, or intra-op frozen section. For diagnostic criteria of PJI, major criteria is sinus tract communicating with prosthesis, or pathogen isolated by culture from two separate tissue or fluid samples from the affected joint. Diagnosis can be made when one major criteria exists. For minor criteria, it is based on lab results and synovial fluid analysis. 6 points or more is suggestive of infected prosthesis. If there is inconclusive pre-op score, we can diagnose using positive histology, purulence in affected joint, or single positive culture. Pre-op and intra-op score can combine together and 6 points or more will suggest infection. For treatment, non-operative treatment is chronic suppressive antibiotic therapy. Operative treatment is debridement, antibiotics and implant retention. One-stage replacement arthroplasty, or two-stage replacement arthroplasty. Resection arthroplasty, arthrodesis, and worse, amputation. That's all for this video. Thank you.